This episode is brought to you by the Society of Physician Entrepreneurs. The Society of Physician Entrepreneurs, or SOAP, is a global biomedical and healthcare innovation network with membership open to all healthcare professionals, entrepreneurs, and industry stakeholders. SOAP's peer-to-peer network empowers entrepreneurs by providing the education, connections, experience, and funding opportunities necessary to commercialize ideas, inventions, and discoveries. To learn more, please visit www.soapnet.org.
You're listening to the IndeDocs Podcast, where we discuss important issues related to our mission to preserve, promote, and protect the practice of independent medicine. Thank you for tuning in.
Welcome to the IndeDocs Podcast. And before we dive in, just a quick disclaimer that we're sharing our personal opinions based on our own experiences and that nothing should be taken as professional, legal, financial, or medical advice. This is Jenna Leith. I am the producer of the podcast, and I'm so fortunate to be here today speaking with Zed Williamson, who is just an uber entrepreneur when it comes to the medical entrepreneurial space, and he's going to unpack some of the details of that in a little bit for us. So Zed, thank you so much for being with us here on the podcast today. Welcome.
Absolutely. Thanks for having me. Looking forward to it.
We're going to have some fun. So if you can, like I said, kind of unpack a little bit what your experience is, what your current businesses are, because you have several, and how those relate to the medical field, especially in regards to our independent practitioners who are listening today.
Yeah, to just start, independent practitioners is why we exist. And we do have multiple businesses, and I'll get into why that also exists. So one company is TrackableMed. TrackableMed is a medical marketing company that uses a foundation of neuroscience to drive patient demand into practices. Office Answer is a phone solution for medical practices so that they don't have to worry about missing phone calls and unpleasant experience from patients. And then Physician Growth Accelerator is a consulting firm for private medical practices with the idea of making it so you're excited Sunday night to go to work Monday morning.
Great. And I'm so excited to explore the philosophy behind why and what you do. I love that we had previously spoken that you really like to be in a teaching space to help people get those skills for themselves, because as wonderful as it is to have professionals like you, some people, especially more in the entrepreneurial space, when you're just starting out or you're still more of a small practice, you may want to DIY some of it. So to really unpack some of the philosophies and principles behind that.
Absolutely.
So a through line that I've really come to understand about what you do is that it all boils down to helping practices maximize their value. And I'd love for you to expand on that a little bit. Why do you think that is important? And one of the first questions I'll pose to you is, why do you think that some independent physicians may feel a little friction when we start to talk about maximizing the value of a business as a business when it comes to medical practice? Because so many of them come to the table wanting to care for their patients, wanting to heal, and that's where their focus is. And they kind of feel some around the business dollars side of it.
Yep.
So can you speak to that as a kind of an opening for us?
Sure. So from a value standpoint, there might be some terms that are like nails on a chalkboard to some physicians out there, and that might be private equity. And the reason is private equity is buying private practices. And so you have to ask, why would they do that? Why would a private equity firm say, you know what, we actually don't have to do that much due diligence because they don't do as much in that space, and we can scoop up these practices? And the reason is because they know there is so much value built into these organizations that is not realized by the current business metrics, the current business approach of those private practices. And they know they can go in, do a couple changes, and massively increase the monetary value of these practices. So we know that exists. I'm a big fan of saying, well, if that's true, instead of selling, if you don't want to, just create that for yourself. And then, as you said, someone might say, well, if I pay attention to business, that means I'm not paying attention to patients. Or the number one focus for me is patients, which means I can't focus on business. And I would just wholeheartedly disagree. It's kind of like, you ever go on an airplane, they say put your mask on first before your child's. And there's a reason for that. And that's the same as business. If you want to avoid the idea of being good at business because it's more comfortable for your brain, you're actually putting your patients at risk because you are now making it harder for you to exist. You're making it more difficult for you to be there as a reliable, local, trusted expert to heal people because you've decided to ignore the importance of the health of your business. Just like you wouldn't want a patient completely ignoring the health of their health, you shouldn't ignore the health of your business.
I love framing it that way because I think so many of our independent practitioners, they're very used to guarding health. That's what they do. That's their life's blood. But they don't look at their business as a living, breathing entity. And so for a lot of them, it's just numbers on a spreadsheet somewhere or numbers on a computer. It's not this living, breathing thing. But when you look at it in that way, I think that might speak more naturally to them in that this is something that you need to care for and feed and help grow and protect and all the things like they do for their patients every single day and why they got into this in the first place.
Correct.
One of the things you had talked about private equity and how it's so easy for them to come in and just be able to pull a few triggers and make it an extremely profitable thing. Do you think, because you've worked with many, many practices over the years, do you think that that's something that physicians are aware of, that there may be these just one or two tweaks, fairly simple things, maybe not easy, but simple, that they could do themselves, that if they only knew about it? Would you say that that's common knowledge, or do most of them find it kind of surprising when you get in there in the weeds and you start to look at stuff? Are they surprised? And if so, what would you say are some of the biggest commonalities that you found that you say, oh, almost everybody has to tweak this, almost everybody has to tweak that, but then it's huge, it's wonderful. So tell me about your experience with that, what you found.
Yeah, I would say there is surprise. And this is built in. I have a philosophy around this, that what makes someone a good physician in regards to how they approach the treatment of patients sometimes can actually get in the way if we approach our business the same way. It doesn't mean you can't be good at business. It just means if we do it the same way, we create problems. So I'll explain. When you have, let's say you're in a specialty like ear, nose, and throat. You know why the patient is coming in. You already understand the built-in kind of root causes of what they're dealing with, and you understand that there are certain options for treating those root causes. And most of the patient's complaint is not actually related to a root cause, it's related to a symptom. And so you spend your time dealing with patients about their symptoms, relieving those symptoms, and maybe getting to root cause. But a lot of times root cause exists in the patient's life, meaning you are not going to necessarily influence the behavior outside of the medical practice. And so what happens is we fix what we can fix. Now, in business, the problem with that is we fix surface problems, which means they just pop up as something else in another way. And you see this with practices investing in new technology. Because they go, oh, you know what? Man, I'm really frustrated with the patient no-show rate. You know what I'm going to do is I'm going to find a company that helps with no-show rate. They find a company, they pay for the software, and it doesn't really help. And it's because we didn't address the root cause of what's creating the no-show rate in their specific scenario. To me, one of the most powerful beliefs that any of us can have as humans is that everything we experience, personal or business, anything, is the perfect outcome of our current system. And what I find is many private practice business owners are frustrated with what they have to deal with, and they're putting that out as the universe. Like, darn it, this universe is creating this frustration for me. And there's so much more freedom and power in saying, you know what, I'm experiencing the absolute perfect outcome of my current system. So now all we have to do is tear the system apart, identify what needs to be tweaked, tweak those things, and then we get the better outcome. And you asked, are there certain things that just pop up all the time? 100%. One of the reasons behind me starting one of the businesses is one of those things, and that is a patient trying to get in the office. There is this big disconnect in medical practices and patients. Medical practices operate under the assumption that they should just be busy because they have appointments available, and that if patients need help, they'll come in when they should come in, and they'll show up and all that stuff. What they completely ignore is that we all have these human brains built for a world that doesn't exist anymore, and our behavior is driven by bias and heuristic. And so these patients that are fading into this discomfort don't really realize how uncomfortable they are. And so they don't call a practice as soon as they should. What happens is it goes past, and they say to themselves, you know what, oh man, now I'm feeling really bad. Let me call somebody. But they don't want to see a doctor. No one wants to see a doctor. And so mentally what's happening is they're subconsciously looking for any reason not to follow through. So if you have a medical practice who never answers their phone, the patient's not going to work hard to get to you. If you have a medical practice who answers the phone, I refer to her as Agnes who hates her life. If she's the one answering your phone, again, the patient's not going to work hard to get to you. If you create barriers for this patient, it's going to drive them away. And this is one of the biggest impacts for private medical practices because, imagine any other business, any other retail, any business whatsoever that would purposely do something to make it so it's really hard for someone to do business with them. That is insane sounding, and we do it all the time in medical practices. Let me have a 97 option phone tree, that just makes patients angry. Let me have AI answer every call and just drive the patients bat crazy. It's you wouldn't do it in other industries, but it's done in medical practice. So I would say that's one that always comes up. I would say the second one that comes up every single time is either ignoring or not paying attention to business metrics. Ignoring meaning on purpose, I don't want to look because I'm either intimidated or I don't understand them or I don't want to know that I don't understand them, or just not paying attention where it's just there's no awareness. And this is an understanding of your income statement, your balance sheet, your accounts receivable, the actual engine behind what makes your business work. And I would say those are the two most common things that immediately always need to be addressed.
That's great. Can you define, I think you said heuristic?
Sure. I like to use just a really easy description as imagine it's an automatic decision-making machine. And so if you think of our brains are amazing for survival. If you go back thousands and thousands and thousands of years, from a logical standpoint, it doesn't really make sense that we are the alpha on the planet from a species. It should be something cool, something with fangs and fur and teeth and strength. But no, it's these weird things that got huge brains. And the thing is we are creatures of avoiding danger. We are not creatures of opportunity. People who think we are, they're wrong. We avoid. Every bias and heuristic out there is really designed for us to not die. That's what those things are. The problem with our existence today is we treat non-threatening things as threatening. And that's what drives behavior. You have a patient who you're talking to them about a procedure, and you've talked about the procedure 10,000 times. It's minimally invasive, super easy, and the patient is experiencing ambiguity effect. And ambiguity effect tells us that if it's not completely clear to them, they will assume worst case scenario. So you say small incision, they expect 12-inch, knife wound. And these disconnects is what creates issues in medical practices.
And I think you had said in a previous conversation that we had prepping for the podcast that you can almost be too detailed too though, right? To get lost in your own knowledge bias and understanding that something is actually great. But if you show them a tool that's tremendously large or something like that, then it can scare them away as well. Can
Yeah.
you talk through that a little bit, kind of the edges of too much ambiguity, but also too much detail, like that comfort space where our lizard brains can be as patients to really understand, this is my friend, I can go here to get treatment and feel safe, because that's part of that patient experience too.
Yeah, if you think about the difference is showing someone a path that is healthy, that removes ambiguity. Answering unasked questions is not. That harms, because when you present something, you don't know what context the person is going to attach to it. And so you bring out a device that, maybe 15 years ago, a surgery was really invasive and just tons of recoupment time, really bad. And now there's this new fancy device that just has this little itty bitty wire. And you're excited about it because you like the technology as the physician. You think it's great. And so you pull it out and show the patient. And the patient faints because they don't get it. You see this a lot in almost every, because medical device makes these mistakes too when they're promoting their technology, when they directly promote that to patients. And you go to websites and you see this huge picture of this device, and the only thing a patient can think is they are going to put that into me. And that doesn't seem good.
Yes.
Because there's no context for them to understand anything else.
Exactly. Do you think physicians at large understand? I mean, they've all been to the doctor too, but they have that knowledge bias. They know, that a lot of this stuff is their best option, is their best care path. Do you think that they have that full awareness of just how trepidatious just going to the doctor for a regular checkup can be, much less? You talked about how people don't want to come to you in the first place, so don't make it even harder to come to you. Do you think that they have a full understanding of just how much people do not want to come see them? Or do you think that knowledge bias gets in the way because they know that they're there to help? They know that they're there to serve. Is that something that you see a lot, with that kind of people putting blinders on or having blinders on because they understand it from the inside out versus from the patient's perspective?
Yeah, so it's actually a really interesting question because there isn't a yes or no answer to it. First of all humans suffer from cursive knowledge, which is just the general idea that it's hard to remember what it's like not to know what I know. And when physicians are speaking to patients, they are always going to have that cursive knowledge. There are also personality types. These are things that are very measurable and understand, there's a lot of understanding around it. So there are physicians who are personality types who get it because they are so connected at the social level with a patient that even though they have this cursive knowledge, they're watching the interaction from the perspective of the patient, and they can put themselves in the patient's shoes. There are other physicians whose nature is not that, and their nature is data, exactness. And so it just, to them, no one should be affected by this information. Of course, we're going to put a 3-inch incision. We're going to put in this thing. It's going to stitch it up. You're going to bleed a lot. And to them, there's no reason why they shouldn't say that to a patient because they don't have that natural skill of understanding the patient's perspective.
What would you advise for physicians that hopefully at least have the awareness that they are that personality type? Because a lot of what you guys do is that soup to nuts patient experience where you say, well, the patient experience doesn't even start when they come through the door. It comes far before that and far after that, right? So if someone is looking to streamline and optimize that process, both from a business perspective, but also from a genuine patient care perspective, right? Because ideally they are married together. When someone is more that personality type that they don't innately understand the humanity side of the patient experience and they're more about the data, what would you advise them to do to glean what that patient experience is like from that human side so they can then use said data to plug into their business and optimize all that?
Yeah, so it's about understanding that system, just, going back to everything is the perfect outcome. So it would be take a step back. Let's say someone is focused on seeing a very specific patient type. And that specific patient tends to suffer with these symptoms. And if they suffer with these symptoms, they are a high likely candidate for X treatment. And so they understand we're focusing our business here. We've seen 20 patients that fall into this category. And I believe all 20 of them were good candidates for this procedure. What rate are those people agreeing to move forward for this treatment? Mm-hmm. What rate of the people who move forward actually complete the treatment? So we understand how many people said, no, I'm not interested. We understand how many people said, yeah, I'm interested, and then thought about it and went, heck no, not doing it. And then do you have an opinion about those numbers as it relates to the health of your business and what you believe patients are experiencing? If you're good, don't change anything. I'm not here to say that everybody needs to do things a way. What I'm here to say is you are currently experiencing the perfect outcome of your current system. If you like your outcome, don't change anything. If you don't like your outcome, we got to dig into the system. If it is someone who maybe doesn't pick up on the patient's perspective, then we like building tools for that person. So instead of them discussing that aspect, we use a video, or we use a talk track that someone follows, or we use another person in the organization. It's all about understanding the system. What I would never say is everybody should use a video, because that's not true. You have to identify where the constraints are within the system before you do anything about it. And the easiest way for me to think about that is, and this is it is a weird picture for me to portray, but I want you to imagine you are 3 or 4 feet underwater. And I'm a nice guy. So even though I have forced you underwater, I have connected a bunch of McDonald's straws together. And you get to breathe through these McDonald's straws. And so 4 feet, it probably takes maybe 7 straws, okay? You're probably good. McDonald's straws are nice and big. You can breathe. If I replace any of those McDonald's straws with a coffee straw, you are now in trouble. But it doesn't matter where in that process it is. It's a constraint. And if we just complain about having a hard time breathing, we're not going to really understand what to fix. So we have to identify within that system of the 6 to 7 straws, what is it that's keeping us from being able to breathe? And then what do we do about that? And so that's how we think about the process of a patient, because we start in this world where patients don't know. That's where it starts. Patients don't know. They faded into their knee pain. It's been growing over 4 years. And they're starting to realize that they don't like walking very much in the grocery store anymore. We have to be able to talk to that person, maybe through advertising, depending on the practice style of what type of patients there are. When they go to your website, they need to be able to say, oh my gosh, this place understands me. When they reach out to the practice, we need to emotionally connect with them so that they feel like this is the guide that's going to help me through this next stage of what I'm dealing with. When I show up to the practice, that needs to be congruent proof to what the expectations that you created on the phone and on your website. And then you have to show me a very specific plan that I agree to. You hold up your side of the deal, all the promises. I get the great outcome. And as a practice, you get to collect from insurance or cash, however your business is set up. And then the patient can't wait to brag about their experience, which either goes online in reviews or at dinner parties singing your graces. And that whole system is what really needs to be reviewed so that you can identify where are the pinch points? Where is that coffee straw that's holding up my breathing underwater?
I love that analogy. Let's say that, I'm a small practice owner and all I can see is, like you said, the symptom of I have a high turnover rate, or I have just don't have a lot of patients coming through the door. The ones that get here love us, but it's getting them through the door, whatever it may be. Let's say high turnover rate, because that's more pinch points in my opinion. How do I start to assess to say, well, maybe it was Agnes that hates her life, or maybe it was that it took them too long to be able to do their paperwork online, or maybe it was that I had to rush through their last appointment and they felt really unseen and unheard. It could be a million different things in there, right? Mm-hmm. So if I only know the symptom, how do I start to break it down to say, oh, okay, well, pare down, pare down, pare down. It's probably this right here, or maybe this plus something else. Where do you
Yeah.
start with that?
Yeah, this is one of my most favorite things in the world. And you can do this with your team. And this is something that if someone's listening right now, you can get a pen out, get a piece of paper. This is a process you can implement literally 10 minutes after this is over. You can go do it. It's called designing failure. So here's what's pretty cool about our brains. These biases that are built in, they're very powerful. One of the most powerful in driving human behavior is negativity bias. And negativity bias tells us that we will always give more weight to something negative than we will positive. You can have a great day. You can have one of the most amazing days in the world. One little itty bitty thing that's negative can make you call your day a bad day. And that's a bias. It's built into us. We are good at that. So let's use it. When you are looking to understand root cause and to repair something that you don't want. So let's call it, what'd you say? You said patient turnover. So in other words, patients never come back.
I mean, not never, but like let's say that I'm seeing a falling rate in that, and I don't know why,
So now here's what we do. You get the team together, and it's going to sound silly at first, but you absolutely create the most amazing plan to have the worst turnover ever. We want to create massive failure.
I love this.
So imagine you get together with everybody in front of a whiteboard or whatever, big piece of paper, say, okay, let's just brainstorm, people. What could we do to make sure that we have just a really high turnover rate? And any idea is good. So what do you think? What are some of your ideas? What can we do?
Mine personally, I'm sure Agnes, who hates her life, I don't love long wait times or shrill wait music, anything that makes the wait on the phone because you're already calling in and you're stressed as it is,
So let's never answer the phone, or if we answer the phone, let's immediately put you on hold. If we do talk to you, let's talk to you with an attitude. If you ask a question, let's act like this is something we don't want to deal with. Let's have, if no one answers the phone, let's have it go to a voicemail, or let's have it go to an answering service that can't help us. All those things, right? Okay. What else do you think we could do?
Oh, I think crowded waiting rooms or having huge wait times. Just again, that stressful place of I'm already nervous. You're making me more nervous and I'm not even seeing the doctor yet. That whole arena.
So let's make sure that no one ever gets into their appointment within 30 minutes of the actual start time. Let's try to make start times at least 30 minutes, maybe even an hour after their appointment time. Let's ask for as much paperwork to be filled out as possible. Let's have a small waiting room overfilled with people who are really sick. Let's have difficult parking, a rundown office space, technology that's difficult to work with, a front desk staff who seems like I'm bothering them. It seems like they're more interested in scrolling Facebook than answering my question. If I am waiting for an appointment as a patient, let's make sure that patient never knows when we're going to call them back. Let's just ignore them so they don't know when. Right? Okay. So let's say we stop there because the list can go on and on.
On and on and on, yes.
Do you think we would have designed a really good way to increase patient turnover?
Absolutely. With even just like 2 or 3 of those things. I mean, you hit the ball out of the park with that.
So you do this with your team. You have this big list. Everyone's going to say the same thing you just did. They're going to say, absolutely. And now the most fun part of this process is you go, let's check off every single one on this list that actually happens here. And guess what happens? 90%. Because the only reason you laughed at some of these ideas is because they're real.
And familiar, yes.
And familiar.
Yes.
Which means we do them. So now what we're doing, here's what we're doing with our brain, which I really love this, is I've just asked our team to design failure. They succeeded at it by describing how we currently operate. So what it does is it forces ownership over the activity. And now you can say, as a team, we got to pick 2 or 3 of these things, and we got to change it into what it should be. So now what should it be? Every phone call is answered within 2 rings. Great. How do we measure it? Who owns that measurement? Who's responsible for reporting to the team how good we're doing? And when are we going to get to 100% by? What else? A patient is never in the waiting room more than 8 minutes without being communicated with. Awesome. When are we starting that? Who's responsible? What's the communication sound like? How will we know they're here 8 minutes? And you start identifying these things, because that same practice is likely to go try to find some software of how to reduce patient turnover.
Mm-hmm.
It's not going to do anything. If you don't like how your car drives, painting it a different color is not going to do anything. And that's what typically happens on the business side of private medical practices, is because they're going. I don't like this. Find a solution for that. I don't like how it's blue. Well, let's make it red. I don't know. Why doesn't it drive better? But it's how our brain is set up. When you design failure, you literally, first of all, it's fun. It's easy because our brain is good at it. And we identify we just described ourselves at the same time as designing failure, which creates discomfort in staying that way. And the biggest thing in business is you can have an idea. Ideas are great. Implementation is where the rubber hits the road. And this helps with implementation, because as a team, we realize we do things that we would consider designed failure. It doesn't really feel that good to do that anymore. So that's one of my favorite, and that's very doable.
That's fantastic. We'll be right back after this.
If you are a physician or an administrative professional working in a medical field in South Carolina, we invite you to consider joining the IndeDocs membership. Members have access to exclusive resources and networking opportunities, and are an essential part of supporting our mission to preserve, protect, and promote the practice of independent medicine. For more information, please visit our website at IndeDocs.com. That's IndeDocs.com.
A lot of what you've said has touched on the concept of tracking, metrics, keeping an accountability in some way, whether it's with a person or with a data sheet or whatever it may be. And again, let's say that I am especially a more, let's say, seasoned physician, that I've had my practice for, let's say like 35 years, something like that, right? It's been a while since I've been doing this. Any of these apps or any of these programs or whatever is not part of my normal run of the thing. And technology maybe kind of scares me a little bit and all of that. What would you say is a good starting point, like the tracking you just talked about? Like, okay, well, let's make sure that we're starting to pay attention to how long patients are in the waiting room, right? And our win is going to be 8 minutes or less. We need to start tracking what it actually is in real life to see what we're working with. Where does somebody like that start? I mean, do you just use like a spreadsheet, a notebook, or do you need some more technological thing? And if so, please share a favorite program you may have. Where can they start with that ever important tracking?
Yeah. So first of all, nothing can't be measured. So first there's a belief. You have to get over the belief like, well, you can't measure that. You could. We have to decide, is it worth it or not? But nothing can't be measured. Then what we say is what is our problem statement? Meaning, what is the thing that we are not happy with? So we don't like how long patients are staying in the waiting room. Okay. What information do we need to get a sense that we're improving that? And how difficult is it to get that information? And is that difficulty worth the potential outcome? So if we fix that, is it worth however we've decided to measure it? And that's just a belief. If once you wrap your head around that, then you can move forward with measuring whatever you want. And I'm happy with technology that helps. What I'm looking for is the habit. The habit and the belief is really what makes everything else work. I pay really close attention to the food I eat. It's just a decision I make, and it's because I've found their benefits. I wake up with a lot of energy. I feel good all the time. I can work lots of hours, go home, have fun with my family for hours, and I just feel really good, and I sleep really well. And so at the same time, I was having a conversation with somebody about food, and they go, yeah, Zed, but people aren't as disciplined as you are about eating. And that statement shocked me a little bit because I don't think I'm disciplined. What I have is a belief. And so it actually takes zero discipline for me to follow the path I follow in regards to how I eat. Just like if someone loves running, like it just they love it. It's the most important part of their day. It doesn't take discipline for them to go running. It's a belief. So what someone first has to do is they have to create their belief around metrics and data. And once you do, you're going to figure out how you're going to measure the things that really matter. And it should be attributed to the system that you're inspecting. If we just go try to measure everything, that's a waste. If you measure a bunch of numbers that are never going to inform a decision, that's a waste. So a question I like to ask, because I'll get excited about measuring something because I do like data. But then I have to ask myself, all right, I've measured this and I have a trend of 6 weeks of this information. What decision am I going to make based on this data? And if the answer is not clear to that, we probably shouldn't spend the time measuring it. So that's a little bit of a blurry space because you can burn your team out by saying everybody measure everything and never doing anything about it. You can also measure nothing and fly off a cliff. So it's that balance. There's a couple tools I am really loving. A tool called RevOps right now.
Is it REVOPS?
That's right. Yep.
Okay.
It connects directly with your EMR and your clearinghouse. And holy moly, have they made that it's brilliant. It really is. And you can really get an understanding of what's going on within your business as it relates to visits that have already happened. It doesn't tell you anything about your future, but to understand, it's to list the metrics would be insane because there's nothing they haven't thought of. It's really, really strong and very affordable. I mean, it really blew me away. That's a system that I think every medical practice should actually just be on. Like, you don't have to check, well, I don't know if I need this data. If you bill insurance, you should be using that.
Okay. And you said there's a second?
Not a second to like specific software tool. It's really just, it's about what is going to drive your understanding of where you are in the system and what you want to achieve. Because going back to, if everything is good, you're cruising in Monday morning, you love work, everybody in the office is awesome, the culture is positive, there's no gossip, there's no drama, you're probably good. It's really about, let's diagnose before we prescribe treatment. Just like if a patient was feeling great and happened to just accidentally, get an orthopedic appointment, you wouldn't tell that person they need surgery. So it's the same thing. You have to identify where are the pain points within your business and then what is needed for us to alleviate those things.
Great. And if somebody is much more low tech, and even RevOps, which does sound pretty amazing, just kind of sounds scary to them, at least at the outset. Do you think it's worthwhile to do a much more low tech, to do a spreadsheet, to do a notebook,
Sure.
to do a something just to get the ball rolling? Have you seen that be effective?
Oh, yeah.
Okay.
Hash marks. You want your front desk counting something? There you go.
I love it.
I mean, measurement is proof. If we measure nothing, we've told everyone that nothing is important.
Yeah.
So some things get measured automatically. The challenge is our brain is really bad at truly understanding measurements if it's not purposeful. So what I mean by that is, let's say there's a private practice physician and he's in a conversation, and the conversation is like, well, how many new patients do you typically have a month? And his brain is going to go grab the best month he ever had in his entire career, and that's the number he's going to use. And he'll actually think, well, yeah, we have 400 new patients. And it's not the real number. If you drive anywhere, like I had a long drive the other day, and I am on roads that have a 70 mile an hour speed limit, a 65 mile an hour speed limit, a 55 mile an hour speed limit, and a couple of roads that were 45 miles an hour. This was a long drive, 400 miles. And I am weird with data, so it's strange that I know this much about my drive. But the first 200 miles, my average speed was 41 miles an hour. The second 200 miles, my average speed was 79 miles per hour. Now, if you had asked me what my average speed for that entire drive was, I probably would have told you 80. Because my brain goes to like, oh yeah, I had those roads that were just 45, but those were short. But what your brain doesn't do is it doesn't calculate the fact that you had to slow down for a stop sign. And it was a two-way stop, so you had to wait for crossing traffic, and then you had to accelerate back up to speed, and then you did it again. What our brain does is our brain goes, oh yeah, I was going about 80. We probably average 80. No, you averaged 41 for 200 miles. Same thing in business. Yeah, I see about 400 new patients a month. Nope. So that's the value of measurement, but overdoing it will make it so you avoid it in the future. So I'm a fan of start small, but start with the belief that it's needed, not that you need discipline to do it.
I like that. And how would you suggest, because we talked about tangibles, you can measure your car speed, you can measure when somebody comes into the office down to the second, you can measure your food and the calorie intake and all of those things. How to, apart from reviews, which are super great, but we all know that that's a slice of your patients. That's not going to be everybody, right?
Yep.
How do you measure frustration level? How do you measure stress level? You know, any of those things that could be that pinch point on the straw, but it's not a number you can necessarily write down on a piece of paper or put into a program.
Yeah.
How do you measure those?
So I believe it is a number. The way we look at it is unique phone calls to your practice.
Okay.
How many do you get? So you got 300 new unique phone calls to your practice last month? Cool. How many new appointments did you book? 80? Something there. Of the 80 appointments you booked, how many showed up? 60. Out of the 60, how many people did you offer treatment to? 40. How many people booked treatment? 20. How many people who booked treatment followed through with treatment? 8. All those are pinch points. And so those numbers tell stories, and you can design failure at each pinch point. How could we hurt the percent of people who choose to move forward with the procedure? How can we make sure someone who calls doesn't book an appointment? How can we make sure that someone has an appointment, doesn't show up for their appointment? And that's so to me, those pinch points are in numbers, and it tells a story pretty quick.
So for you, it's more looking at the evidence that's created around whatever that emotional feeling may be or mental process may be for them, because you can't say, you're a level 6 stress today. I mean, I guess you could, but like that's very subjective.
Sure.
To say that you're looking more at the measurable, tangible data that surrounds it and saying, okay, well, we're really seeing a lot of that there. That must be a stress point for a lot of people.
Yeah.
Is that accurate?
It is. And what's interesting about the human brain is we're not very different from each other. And so once you start to see it, you can brush with broad strokes with that understanding. You know, I'm also in the advertising and marketing world, and I am 100% against focus groups.
Interesting.
They are, to me, a total waste, because I could structure a questioning process to get you whatever answer you want. So if I can influence the outcome with how I ask questions, what value do you think you're getting in asking questions? So what happens is you have a company, they're like, oh, we need to interview 60 people. And, the focus group says that bananas that are slightly more yellow are better. It's silly. Because we have brains and because there is so much understanding of neuroscience and cognitive behavior, you can talk to 2 or 3 people, have the conversation about bias and heuristics, and you can broad stroke that across full populations, and it is extraordinarily accurate.
I like it. So what would you say if you could wave a magic wand and do a lot of good for all the independent physicians out there and just make something be real, be true? What's one thing that you would want them to understand, like truly understand without fear or bias or any of that type of thing, to just have that knowledge and understanding as an innate thing? And also, if you could wave that magic wand and say, everybody out there who has an independent practice, they would go out and do this tomorrow or look into this tomorrow. What would you want them to understand, and what would you want them to do if you had that magic wand?
Yeah, those are good. From an understanding perspective, the people are going to hate this answer. I'm just going to let you know. It's tied to your financials. One of the most common mistakes I see is at the end of the month, or maybe early in the beginning of a month, the physician business owner gets an income statement telling them how last month was, and it's called a cash-based income statement, which means it's showing what was deposited and what was paid. And they make an assumption about the health of their business based on that document. And the assumption is wrong, because that document tells you nothing about the health of your business from a standpoint of trend or understanding. Because the deposits you got in November was not from the work you did in November. It was from the work you did July, August, September, and October. And if you don't understand what created the inputs in those months, you have no idea what created your deposits in November. And so if you think that November was a better month than October, and you think that in December, you're lying to yourself. And it's really easy to make horrible decisions. Man, we had such a great month. It was such huge profit. You know what we should do? We should open a new location. If only we had more space, we'd be able to see more patients. Look at this. This is unbelievable. You spend all this time, this investment, money, and then shoo, it all goes away. And it's because you forgot that you took a 3-week vacation 4 months ago. And that wiped out revenue being deposited into January. And so I think, that is really hard for people to wrap their head around. And it's because no one really takes the time to show them that information. But just imagine if you looked at something and you were looking at 4 months ago. That's what they're doing, but they think it's today. And imagine if you made that decision.
Yeah. I think it's very much the plant and the harvest philosophy of, you have this great harvest, but it's not stuff that you put in the ground yesterday, stuff you put in the ground 6 months ago, a year ago, whenever it is. And to not understand that whole process led to this, and a bad planting is going to create a bad harvest.
Right.
And sometimes a great planting is not always a great harvest. There are so many steps in between. So to understand that there is that gulf that you have to accommodate as you're evaluating. So that's great. And what would you, if you could wave the magic wand and have them do something? And again, I know you said the specificity to your business, your practice, etc. But if you could say, if you did nothing else, at least go do X.
Another exercise they can do on their own, a big miss, and I wish everybody would just go do it, is your current practice has some rock stars in it. And those rock stars have behaviors that you're aware of. Write those behaviors down. Understand what makes those people rock stars within your business, and turn that into the standards in which you hire new people and remove people from your organization. Because here's another thing that happens with our brain. As a rock star employee of yours, it's an unfortunate cycle, but here's what happens. A practice is under some kind of stress, okay? And it has some employees that are rock stars and have some employees that aren't, and maybe some really non-rock stars. But the practice doesn't like the idea of hiring, and they don't like training, and so they keep people. And then they end up spending more time on the non-rock stars because those are the people who need the most focus. And then we're ignoring our rock stars. And so the people we ignore leave. And the reason is because the opposite of love is not hate, it is indifference. And so the person who was a rock star that you absolutely appreciated, but you saw it as an ability not to have to pay attention, you drive the best people away, and you do all this work to keep the worst people. And all of the data is sitting in front of you of how to create an amazing team and culture. Take your rock stars, make a list of their behaviors, make that the standard in which people are allowed to work in your environment. And if they don't hold themselves to that standard, they're not allowed to be here anymore. And we don't hire people that don't live up to that standard. And instead of focusing on the bad behavior and trying to pull someone into good behavior, shine the light on the good behavior. And it's such a different environment. We spend so much time at work. You do that one thing, everyone is happier. You're battling so many things. That rock star, once they tip over and they realize that, or they feel like they're not appreciated, and they feel like it doesn't matter that they're a rock star because people who are not rock stars are getting all the attention. And they start going home and telling their spouse, you can't believe it, this, blah, blah, blah. That is hard to battle. Because now you're battling a connection point of a spouse and a spouse to be able to complain about work. Or imagine if you could be the place where when your team went home, they were influencing their spouse about being excited about work.
That's definitely the goal.
Right.
Dad, this has been fantastic. For further reading, for further investigation into other resources, is there anything that you would specifically suggest that our listeners go check out?
Yeah. So first of all, I am going to recommend some books. First, if you're not consuming lots and lots of books, you're missing out. To me, books are a cheat code. We get to absorb a lifetime of someone's understanding and knowledge in a few hours. And it's just, there's so much value in them.
And audiobooks are great. I will jump in and say, because they've been a lifesaver for me. You have these commutes, you're working out, you're trying to make food for the kids, whatever. You can still absorb the information.
Yeah, you're maximizing the time. I mean, imagine if there was a separate dimension and you were competing with yourself and one of you drove, 3 hours a week listening to audiobooks and one drove 3 hours a week not, right? Imagine 10 years, the difference of those two lives. So big fan of books. We actually do something, and I tell this story because I like when I hear people pick this up. All of our employees get paid $50 for every book they read.
I love that.
And we have a list of 100 books that they get to pick from. And it's been really, really special because it's cool when people kind of catch the bug of learning something that maybe they wouldn't have gone down the path to learn. But so a couple that jump out at me regarding what we've talked about. There's a book called Scaling Up by Verne Harnish. And I like it because it's very prescriptive and easy to understand. Traction by Gino Wickman is similar. They actually worked together before they both wrote those books. And that's another nice one to just start thinking about the business as a system, as a process that you can identify constraint. There's a book called The Goal, which actually talks about constraint theory. And the last one I'll mention is one that it's going to be your hardest read. And when I don't mean difficult to read, it's going to be hard for you to hear what it's telling you. And that is Leadership and Self-Deception. And That book is so powerful. If you really want to turn the corner on what you and your organization are able to achieve as a group of humans working together, it's a really powerful book. And you're not going to like what it's telling you.
Sometimes the hardest lessons are the best lessons.
Yes,
so
absolutely.
That's great. That's great. Wonderful. And if someone says, this guy's the best, I want to hear about all the things he does, how do I get in touch with him? How would one find you?
Sure. So I think, probably the easiest thing is to check out, I have a podcast called the Physician Growth Accelerator. They are 8 to 12-minute episodes, very actionable. You can swoop in, grab something, use it that day. And that's probably the best place for someone to capture a lot of ideas. If they want to reach out, they can reach out through the Physician Growth Accelerator website. Or if someone is frustrated, let's say someone's investing in advertising and you're frustrated because you feel like you're just lighting money on fire, you can go to TrackableMed.com. It was my first business that I started 15 years ago-ish. And I started it because I was upset with the industry. It drove me nuts. And we define a result as something you can deposit into a bank account. We are not into vanity metrics. It's what are we here to achieve? And so I would say one of those two things would be good. PhysicianGrowthAccelerator.com and TrackableMed.com.
Beautiful. We have covered so much excellent ground today. It's been a really packed full episode of wonderful resources and insights and actionable tips. If there was one thing that you would say that you would wish for people to take away from this, obviously we want them to take away a bunch, but if there was just the one thing above all, what would you wish that to be?
Everything you experience is the perfect outcome of your current system. Own it. That's where all of your freedom exists. The key to your own freedom exists in that belief. It gets us out of the world is doing this to us. It gets us out of those darn insurance companies make my life hard. Those darn patients are hard to deal with. Everything is the perfect outcome of our current system. If we want to change, we got to tweak the system. It's no big deal.
I love it. Thank you, Zed, so much for your time and your energy and your enthusiasm. It's so refreshing and wonderful to have somebody bring so much passion to this space and to break everything down in such a clear and understandable way. So thank you so much.
Thank you. I appreciate that.
And to everyone listening, thank you for joining us. Please make sure to rate and follow the podcast, as that really helps us to grow this community and spread the word about the issues we've explored today. And please tune in next time for another great discussion about independent medicine in South Carolina. From all of us at IndeDocs, take care and stay well.
Thank you for tuning in to this episode of the IndeDocs Podcast. Our producer is Jenna Leith. Promotional support by Uplift Marketing. Mixing and mastering by Noah Martin. Content editing by Jenna Leith. Additional production support by Noah Martin, Rebecca Lockhart, John Robinson, and the IndeDocs Board of Directors. For more information, please visit us online at IndeDocs.com.